The Arjo Maxi Lite has been designed for all daily lifting requirements, from general lifts such as assisting the patient from the car, bed to chair, chair to toilet, chair to car, to lifting from the floor. The Maxi Lite has an integrated charger which simply plugs in to be charged, but a wall charger is available as an option. When the battery pack is fully charged, disconnect the electric power and wrap the cord around the power cord holder. An electrical connection is made automatically. Ensure that the red emergency stop button is not engaged and that a sling is available. The base of the lift can be set with the legs open or closed. Pressing down the left side of the pedal will close the legs. Pressing down the right side of the pedal will open the legs. The Maxi Lite can also be folded. Simply remove the spreader bar by taking off the clevis pin clip, lower the boom to its lowest position, lock both rear casters of the lift, and remove the shoulder bolt and the locking knob from the mast, and fold the lift till the boom touches the floor. After the boom touches, insert back the shoulder knob in the proper place to block the mast. The caregiver can shut off the electrical power at any time by pressing the red emergency button on the front of the control box. Reset the emergency shutoff by turning the red button clockwise. Foot-operated brakes are fitted on both rear casters. The brakes on the Maxi Lite should only be used when the lift and the client are resting, when the lift isn't being moved while transporting a client, and when traveling across or stopping on slightly inclined floors. Brakes should not be used when raising or lowering a patient in the lift over a bed or chair. The caregiver should always explain to the patient what to expect during the lift and transfer process. Place the sling around the patient so that the base of the patient's spine is covered and the head support area of the sling is behind the head. Pull each leg strap under the thigh so that it emerges on the inside of the thigh. Ensure the positioning handle on the spreader bar is facing away from the patient and that the wide part of the spreader bar is at or just below the shoulder level. Position the spreader bar close enough to be able to connect the leg strap clips of the sling to the frame. Connect the leg straps first, then tilt the frame and attach the shoulder straps. Ensure that all clips are securely connected. Then, raise the patient using the hand control. The head support area of the sling should now come into use. This is the most comfortable position for transfer or transportation as it reduces pressure on the patient's thigh. The angle of recline can be increased for the comfort of more restless patients when lowering the patient's back into a chair or transferring to a chair from the bed. Before transportation, turn the patient to face the direction of travel and keep at a normal chair height. This gives confidence and dignity to the patient. Avoid lifting the patient higher than the eyes of the caregiver to lessen the impression of height for confused patients. Support the patient to prevent excessive swinging and to give a feeling of added security. The patient may be transferred to and placed in a chair or on a bed. Lower the patient and unclip the sling from the spreader bar. Move the Maxi Lite away before removing the sling from under the patient. The Maxi Lite can be cleaned by wiping it down with disinfectant. All surfaces should be wiped down between patients. All slings are color-coded to make size selection easier for the Maxi Lite. Maxi Lite is a mobile passive lift with a safe working load of 350 pounds.